Slight delays. All right, there we go. All right, so here we are to talk about Regenexx as an orthopedic alternative to dealing with degenerative conditions. So today's talk is going to be focused primarily on the spine and the knee, although we treat every joint that's in the body. And so that's a picture of me. I attended Tulane University School of Medicine, and then I did my undergrad, my internship, fellowship, residency, all at University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. And it was very cold. And I completed my interventional orthopedic foundation training in learning about the regenerative aspects of treating orthopedic conditions. Started in 2018 and completed in 2019. And as with everything in medicine, there's always ongoing training. So here with me is Dr. Buzanowska, and she also, she went to Wright State University, the Boonshaw School of Medicine in Ohio, and then did her internship and residency in Pittsburgh, or same place I went just a little bit later, and did her fellowship at the University of Pennsylvania, and she's formerly on the staff of Cleveland Clinic. And she was trained in interventional orthopedics in 2022. And so we come with, years and years of doing these procedures. So the training with interventional orthopedic foundation is to make sure that we have a standardization of how we treat using either bone marrow concentrated cells or platelet plasma cells. And so let's talk about a little bit about the history. So Regenexx, it was started back in 2005 by two physicians, Dr. Centeno and John Schultz out in Colorado. And they were the first to start doing these injections using plasma as well as bone marrow concentrated cells, which contain stem cells in Colorado back in 2005. And so because of that, what they did was track every person anybody who has a procedure, we track them, right, in order to see how well they respond to a treatment and how long that treatment sort of some either reduction in pain or improvement in function. And so they have about 80,000 people that we have that have had procedures, and then we keep a registry, which is a collection of all those patients and follow them at certain time intervals from day 1 to 10 years out. And because of that, you can say that, we've done a lot of procedures. 80,000 is a lot of procedures collectively, right? Mm-hmm. So that leads to, is this something that's safe? And really, the most common side effects is pain at the injection site where we do. And so it is a very safe procedure when run appropriately and by trained professionals. And they've done the most research in this as far as looking at how your body responds to platelets. What do the platelets actually do once injected? How do stem cells, the bone marrow concentrated cells, how do they grow? How do they help your body sort of repair some of the damaged areas and replace some of those injured areas? And so they have the most research regarding this. And that's why we're a part of it. And so what is interventional orthopedics? That's what we're talking about, right? We're talking about doing injections in things that typically in the past had to be treated with surgical intervention, where we had to actually go in and suture things together, remove, shape, bone down, those sorts of things. And so currently, we have a sort of logarithmic projection from simple injections to surgery. And what we mean by simple injection, these are injections that you may have had, where these are injections that go directly into joints. They're typically done blindly, and that's it. So shoulder injections, knee injections, and maybe ankle injections, hip injections, etc. And then the bursa. And so with that, about 4% of physicians are actually using some image guidance, meaning that instead of just going by landmarks, we're actually using either ultrasound to guide a needle into the joint to make sure that our targeted projection is putting what we have in that syringe directly where it needs to go. And then you have about 1% of physicians doing interventional orthopedics. What that means is that we're actually injecting things and problems of the body that typically only were treated with surgical intervention. And what that means is that, as you can see on the slide, that, we're injecting not just in the joint, but in the hip. We're injecting the IT band, we're injecting the ligaments of the hip, we're injecting in the bone, we're injecting cartilage, we're injecting muscles, tendons, and even nerves. And in the knee, we have the tendons of the knee, the front part, the ACL, the anterior cruciate ligament, the meniscus.
So the stem cells and stuff like that come from something they have already, or y'all get the stuff?
Everything we have, we'll get, I'm gonna dive deeper into that, but everything is from you. Everything is coming from you.
Will be woke or sleep.
Well, I'm gonna get to that, so hold that. I have an answer for you a little bit later. And so, so you can see that we inject more just simple injections. We inject everything, the bursa muscles, the labrum, the ligaments that keep everything together. And so we're able to pinpoint precisely on how to do that. So the other thing we look at is a holistic approach. Because typically, if you're treated right now with conventional medicine, insurance companies dictate that we only treat one thing at a time. Well, what about if we could treat everything all at one time? So we look at more of a holistic approach. How does one joint, especially the shoulder and the neck, are they sort of an issue? Or is it maybe the back, the lower back, lumbar region, and the hip? So we look at things in totality, but also from a holistic approach. And while you're here, you're trying to figure out, is this something that might benefit? And that's what we're going to discuss. And then we can find out later through the one-on-one consultations whether or not this is something for you. Because this is not for everybody, and we don't do this on everybody. Okay. And then that goes back to help scheduling. If you hear something, you want more information, you want to figure out if we can help you, then that's when we get to scheduling appointments and then looking at that specifically for your problems. And then in that picture, you see Dr. Buzanowska. She was doing injections in the facet joints, which are joints in the spine, and she's looking at the camera to make sure her placement of the needle is accurate and where it needs to be. So, this is right, knee problems. Specifically, we're talking about spine problems also, but this is applicable to any joint. If you've ever had these issues, you know that most commonly, we brace things, we try to limit motion, pain and inflammation. We may give you some sort of medications, which would include anti-inflammatory medications, steroids. You might go to physical therapy. You might see a chiropractor. You might do an in-home physical therapy. You might do aquatic therapy. You might do a combination of different types of therapies, even massage, acupuncture, etc. And so these are good ways to help you regain motion and strength, but they may not necessarily alleviate the pain, and they may offer only temporary relief of the symptoms you're experiencing. And medications that we do use, such as steroids and other things, right, they do come with, they're not benign. They can come with some long-term potential side effects. Right, can thin out bone, can increase blood sugars, can thin out cartilage, can cause irritation of your stomach, your kidneys, all those things. We use them, okay, but we can't become reliant on them as a daily treatment, because long term it would create some problems, and they may not be effective for everyone. Right? Everything we do is not 100% effective in anybody, so we're realistic in this, and so we're talking about non-surgical approaches. How can I help repair something and prevent going under the knife or being cut on, etc. And so that picture there is just a picture of somebody with some mild to moderate knee arthritis, and you can see the joint. The joint space looks pretty good. You see a little bit of white sclerosis in the margins, and these are some of the things that we treat. Like I said, what is interventional orthopedics, right? So you can think of it as, interventional cardiology. Instead of going ahead and do bypasses, the cardiologists are doing different things, such as putting stents in, and doing a lot of things through needles, traveling up veins and arteries. So we're looking at doing the same thing, but helping you stimulate your body's normal repair mechanism to help fix common orthopedic conditions. And it's a fix as well as helping alleviate pain, because the whole notion is to get you back to whatever your functional goal is. If your functional goal is to be able to walk with pain, to be able to play with grandchildren, to go to church, to be able to travel, and all of those things that we want to do. And so, and it's an alternative to orthopedic surgery, right? So who is this for? People who want to avoid surgery. There are some people who don't like it cut on, like my dad. Had surgery at the age of 81 for colon cancer. It's his first surgery in his entire life. He had other issues, herniated disc, but he chose not to have it done. People who want to keep all their parts. I came into the world with everything. I want to go out with everything. There are some people who are like that. People who don't want to take time off, don't want to be down for a long recovery process. People who don't want to take medications to manage or mask the pain. People who already had surgery and now they're pondering whether or not they want to have an additional surgery. People who know someone who had a bad outcome, right? And medical contraindications. There are some people who can't have surgery because of their other health issues. It might be heart, might be lungs, might be immune system. But there are many reasons that can happen. And in the picture, you see, people going out on a picnic. So you can have a leisurely desire to experience life without many interruptions, or you can, hey, I want to exercise, I want to walk, I want to run. Whatever your goal is, then that has to be a reason why you're either on the webinar or present here today for us to talk about this. All right, so how are we different? So when you look at what we call orthobiologics, those are things that come out of your blood. And everything that we do comes from you. It doesn't come from a bank. It comes from somewhere where placentas or tissue is used. But so the whole umbrella chemicals that exist within our bodies, a lot exists within platelets, and those platelets send signals out to our body to say, hey, I need you to come and help fix a problem. Okay. That kind of slows down the older we get. And it's like mail that comes to your house. You can deal with it, but once life gets in the way with kids and other responsibilities, the junk mail piles up and you get behind. So our bodies get behind on helping fix its own problem that it was so good at when we were much younger. We look at bone marrow concentrated cells. Those are cells that we take out the bone marrow that contain cells that can have the ability to turn into other things in the environment, tendon, adipose tissue. So adipose tissue is used to act as a filler. Adipose tissue actually has the largest number of cells that have the ability to kind of change into its environment and help prepare stuff. However, it's illegal to do that. So we use it as a filler. It's a great filler. Meaning that if you had a hole in the wall, you want to fix the wall, right? You have to patch it. So it's more of a patch, but it's a great tool that we have in our tool belt to help patients improve. And then there's extracellular matrix stuff, like you might have heard of people using placentas that are sterilized and those sorts of things. And now those things are hard to find because of regulatory issues. So we don't use any of those. And then, of course, we have concentrated platelets. So those are the things that come out of your body. Platelets, one of the big functions that people are aware of. When you get cut, your platelets stop you from bleeding, they form a scab, and then 5 to 10 days later, your skin is back to normal. So the platelets have something in them to help repair an injured area. All right, so you see a picture of me doing an injection in somebody's disc, and instead of me using steroids, those sorts of things, that's using platelet-rich plasma sort of heal or fix the issue that they were having in the disc with avoiding surgery. Okay, and so 80% of what we do, right? 80% of what we do is platelet plasma or concentrated platelets. Only 20% of what we use to help treat patients, it consists of using bone marrow concentrated cells. Okay, and so not everybody needs bone marrow concentrated cells, and there's a cost difference with those. And so, if your condition is more amenable to respond to concentrated platelets, then that's what we'll recommend. And like I said before, not everybody's a candidate for either of these because either they have conditions that have gone too far, or they're, if your health is really frail, then we're not going to do this. Okay. And so, what is structure we're talking about? We're talking about injecting the bursts. Now, how many people have heard of bursitis? So, if you have bursitis, yeah, these are things that exist in your body that we can inject. Joints, going into the joint itself, the ligaments, the tendons, the labor and specialized cartilage areas that exist in the hips, as well as the shoulder, we can inject all of that. Bone, we actually go in and inject bone. The muscles, as well as the nerves. Now, in this picture that you see, you'll see somebody, this is an MRI, and that yellow arrow indicates somebody who has a posterior cruciate ligament tear. Okay, you can see how swollen it is. There's some bright signal in it. And this was from a patient who had an injured nerve following spine surgery, where her front of her legs, her quad muscles no longer worked. So when she went to stand up, she couldn't control how fast or slow her knee went from bent to straight. And what that did, that just caused a lot of tension on that tendon, or that ligament rather. And so when she came to us, we decided to inject her with platelets. So you can see the pre-injection, where it was nice and swollen. And 3 months after post-injection, we got another MRI to make sure that it had repaired itself, and it did. And we did all this. And so we have a couple of cases we'll talk about. Maybe it's applicable to something you're going through. And so that's Dr. Buzanowska. She was doing a plasma injection on a patient who had right knee moderate arthritis. She had patellar instability, meaning that the knee, when you flex the knee, it didn't stay in the middle, it kind of moved from side to side, as well as the ligaments on the side of the knee, they had a little bit of stretchability to it. So we call it lax. So ligaments should be tight and taut. So when the knee joint doesn't shift. So the patient was experiencing all this for years. And she heard about us, had a consultation with us, decided he had steroid injections that really didn't help. She had physical therapy that didn't help. So we're going to go through all the normal steps to make sure that you have tried everything before we look at doing this. So she decided to have the injection, and we just saw her about 2 weeks ago. She's happy as a clam playing with her grandchildren. She can go up and down steps now with no pain, and the knee does not feel like it's slipping out of place anymore. And so you can see in this image, Dr. Buzanowska is using ultrasound guidance. So most people are familiar with ultrasound when women are pregnant, but ultrasound is used for many things. So we can look at structures, ligaments, tendons, and cartilage tissue using ultrasound, and then precise inject it where we want it to go. So here, this is a patient of mine, 20-year-old female with a meniscus tear, and her knee was dislocated. So we did Regenexx concentrated platelets on her in April, and then this is her video from 2 months. Well, you'll see it 6 weeks afterwards. I'll let her do it because she did this. She was so happy herself. So let's see if it doesn't play, then we'll play it again through Microsoft Media Player. And I'm not sure if. So you can see in this video, she's struggling to do a single leg squat. And now 6 weeks afterwards, she's doing squats with weights. Now, not everybody can do that. And so now she's doing dumbbell squats. And then he's gonna go to single leg lunges and stationary position. And so she is extremely happy now. I see somebody young, right? So what we talked about before using concentrated platelets. So the younger you are, we don't have to use as much concentrated platelets, which means that for every person that may be considering this, it's not one shoe fits everything. Everybody gets a specific dose of concentrated platelets based upon what your problems are. So we don't come here and say you get this, you get that. Everybody is completely individualized, which is what we like. All right, and so spine conditions. A lot of people, 80% of people are going to experience some sort of back pain throughout the course of their life. And so when we look at the spine, we look at injecting the disc itself, right? Before you had to look at having this hernia back picture, having surgery, where they would just cut it off and hopefully you weren't one of those 10% of patients who would have a reherniation. Uh, and so we inject the joints, like you saw with Dr. Buzanowski before, where we inject the facet joints. We inject the pinched nerves, also the ligaments of the spine, as well as muscles that have gotten atrophied or smaller because pain limits function. And the old adage my grandmother would always say, if you don't use it, you lose it. And so in this picture, this was a 41-year-old gentleman with a herniated disc, pain just in his back, had tried everything for over a year. He didn't have any tingling or in his legs or any problems with controlling going to the bathroom, and he did not want to have surgery. So we took some bone marrow out of his pelvis, concentrated, processed it, looked at the number of cells, and then re-injected into his disc. And by 3 months, his pain has significantly improved. He was back to exercising. He lost 20 pounds that he had put on because he couldn't exercise. And then we did a re-image of his spine, and you can see in the second image that the width of the canal is significantly improved, that he doesn't have any further compression of the nerve that was causing his pain. And so these are some things. Now, not everybody is a candidate for these either, because if you have bowel bladder control problems, then I'm going to tell you need surgery. For this instance, if you don't have those things, you want to avoid surgery, then this is something we definitely would look at if you have tried the normal treatment options to see if that would work. And here's another case of a 62-year-old male from Alabama, working in the forest industry, sort of like a ranger, had pain every day, and just got sick and tired of doing that. They wanted to continue to have a life without having surgery. So in the picture, you see an image on the screen where I have needles in the two discs, and we injected him. And he has no more back pain. He can walk and do everything that he wanted to do. And so he's extremely happy about avoiding surgery. And now, does that mean that every person that we inject avoids surgery? No, there's some conditions in which we inject and it doesn't improve and they have to go ahead and have surgery, but at least you have tried everything before you know that is the final step, that this is the only way you have confirmation that you have to go, or we can avoid it. And so we're talking about avoiding it. All right, there we go. And so why is it important? Dosing. We talked about dosing before, right? Your platelets that we use, your cells from the bone marrow that we use are going to be individualized for every person in this room, whether or not you're like my son when I did him at 15 years old. So the oldest person from a numerical standpoint I did was 92 years old. Okay, but that 92-year-old was physically active and doing stuff. And she wanted to continue to do that. And so after she had a fall and had a fracture in her back, and that was fixed with cement, she had all this other pain. Well, all that pain was coming from her joints. And prior to that, she had no pain before the fall. So we were able to help that. But everything we do is individualized and customized for every person based upon when their age and then the condition of what we're trying to treat. And so it's important because you know what you're getting. Okay. You're not getting what the person got before you or after you. or a friend who may have had this procedure. Everything is individualized just for you. So are we using cells out your bone marrow? And you get the right medicine for the job. Because I would not give you the same dose if you're 50 or over that I would do for a 15-year-old. Because I know that that would be what we call underdosing. That's like giving an adult a medication when it's supposed to be for a child dose. So an adult needs an adult dose, the child needs a child dose. Okay, so that's why we like to be specific in what we do. And so we talk about visits. So if you come in, your first visit for PRP is gonna last about an hour. I'm gonna sit, talk with you, go over everything that's happened with the condition, the treatment options you've had, the outcome of those things, and then do some sort of diagnostic imaging with ultrasound on the joint, because we want you to see and know what's happening with you, as well as review whatever imaging you have. So if you haven't had anybody go over MRIs, X-rays, if you're a candidate, you've gone through all this and say, I want to go ahead and proceed, then we'll draw blood, which will vary based upon what we're treating and the concentration for the right dose we want to achieve. We draw that, and then we will spin it down, get it to the right concentration, which takes several hours. And then you would come back to the operating room, and then we would go ahead and perform a procedure either with sedation or without sedation based upon your individual preference and based upon what we're doing, because there are some procedures we do with sedation. When we go into discs, we always do sedation. If we're going to harvest bone marrow to get those concentrated cells out, we sedate you, because we want you to have a good experience, right? After the procedure, some patients may need customized, directed physical therapy or rehab. And if you are, besides the information we give you, then guess what? We're going to send you to somebody we trust to manage your post-rehab course to get you in the best functional shape you can be. And then you'll have follow-up visits, usually 6 weeks, then 3 months, and 6 months. And if you're doing great at that point, we may not see you back for a few years. Because, on average, going on 4 years. So everybody's a little different. And some people ask, well, Doc, does this have to be repeated? Well, we don't tell you that. Sometimes it has to be repeated. It may not have to be everything we did before repeated, but we like to see what your response is. If your response is great, then why repeat anything? There's nothing to repeat. And so when we look at bone marrow, right? Somebody asked about it. Yes, these are your cells. They don't come from anybody else. These are cells that your body produces. And first visit, just like before, lasts about an hour. Okay. If we're going to take cells out, we will, we call it till the soil, right? We get everything ready for the cell. So it's like if you're a farmer, you're gonna get that soil condition right for the seeds, make sure the fertilizer and everything right, and then get the okay. And then we have to then do a little bit of fertilization. And so some of our treatment protocol and how it works out best for your schedules.
So what you're saying is, you're gonna extract the bone marrow, that day. Inject the bone marrow, that day. What do you mean by fertilizer?
Well, in some instances, some of our protocols have changed. So in some instances, patients would come back 2 days later, and we would do an injection into the whatever joint we're treating. Now, this is mainly for joints in order to give those cells food, right? Food. Yes, the living cell needs food and oxygen,
Okay.
right? So some of the protocols have changed. We have options, and so that may not necessarily be an option, especially if you look at the picture where you can see a needle going into the joint. And in this picture, you can see I have on the medial side of the joint in the femur of the thigh bone, and then you see one going down into the shin bone or the tibia. And if you notice that the spacing between the bones is a little bit more narrowed on the inside of the joint versus the outside on this side. So this patient was suffering from more focused, localized arthritis on the inside of the knee joint. And so that's what we targeted. So we injected the bone to help stimulate cells to grow and increase the production of cartilage. So in this instance, they wouldn't have to come back to get the injection to help fertilize at that point. But that's going to be something we can talk about on your appointment to answer all those questions. But yeah, we have different protocols to help. And so what you see on the left side of the screen is an injection in somebody's disc that I did also. So the beauty of the holistic approach is what we do. Guess what? We get the knee and the spine at the same time. I don't have to do your spine and have you come back to do your knee. That's what we do when we talk about Regenexx. We don't like nickel and diming people, right? We're going to do the most we can, and we operate differently than traditional insurance. And so, all right, so you talk about harvesting cells. So here we have an image of Dr. Buzanaska performing a bone marrow harvest. So we take out cells from the pelvic bones, and we will sedate you and numb you up, anesthetize, give you conscious sedation, so you're breathing on your own. And then we do this, what we consider our pain-free technique. And so it's Dr. Buzanaska. So that way, when patients wake up from these procedures, they don't feel any pain. And so we perfect our technique to make sure that one is safe, two, you're comfortable, three, it is pain-free. And then four, of course, we get the right amount of cells to treat the condition that we want to treat, right? Because it's all variable based upon even the people on the webinar and the people in here is all customizable and individualized for you. So the holistic point of view. So what do we look at? We just don't come in, you look at if your left knee is hurting, we just don't look at that left knee, right? We want to look at both knees and see what are the difference between those two. So we look at symmetry, right? How do you compare to you? So, and then we look at stability. How stable is that particular joint? Is it a joint that's stable? Is it arthritic and collapse to where it becomes unstable? And maybe we need to do a little bit more in our approach to what we offer to treat that joint. We look at how the nerves that innervate the muscles, you know, they're sending enough electricity to stimulate the muscle to do whatever you want it to do. Because you may have some nerve damage resulting in muscle weakness. That's part of what we need to treat. And then how does the joint move itself? Does it have full range of motion? Does it hurt at certain motions or certain limits? Does it have any stops, clicks, those sorts of things? So we're looking at all of this in comparison to the other side of you that may or may not be a problem. Because that way we can have one, we can show you what the goal and the outcome should be. And it also directs our treatment plan. So after you've had all of this, you know, we look at, like I said, some people don't need physical therapy because if you're an athlete that exercise all the time, you've been injured, you sort of know how to perform most rehab things for yourself. You may need just a little bit of instruction that you can then read on your own. And then there are times where we have to send you to somebody because the pain has been so debilitating that it's resulted in a lot of physical and functional issues. And so we need to address all that at the same time, making sure that we care for the cells that we've injected, right? And we want to restore you back to function. And so we have to have one goals at the first visit and then a specific target that's reasonable to where you are physically. And like I said, some people may not need that right away. So we do all these procedures, and what does that mean, right? We don't do them, and then we don't want to have what we call anecdotal evidence. That means that I did a procedure on you, and then you told a friend, and you told a friend, so now because you had a good experience, therefore he's going to have a good experience. No, so what we do is we collect all the data. Remember, I told you we've done about 80,000 procedures collectively. All that goes into data because in order for insurances to eventually pay for this, they want to know how well does this work? And why should we spend our money on something that we don't have any hard data, right? Everybody want to see numbers. And so that's why we keep a registry of everybody who has a procedure, whether or not the outcome is great, outcome is average, or the outcome is poor. We keep all of that. So we give you a realistic number of, okay, patients with your conditions, you know, 70% of them overall do this at a certain period of time. So, and what does that mean? It means that Regenexx has published over 40% of papers on PRP injections, orthopedic conditions, as well as bone marrow concentrated treatments in the world. That's a lot. So if you're looking to determine who should I trust, who should I, consider doing this, well, you want somebody who's one, well-trained, two, that they've produced data, and then three, they have outcomes, right? You want to be, certain that you're at least considering doing the right thing and choosing the right person to treat you using a non-surgical approach. Right. Don't know what that is. Let's see. We're gonna get back to our presentation. All right, so let's get back here. I don't know what happened there, but sometimes that's what we call pullback. All right, so when we're looking here, and if you don't see, I see the chat box as well as Q&A. So if you don't see my slides moving, then there we go. All right. If you can't see that, if you're on virtually, let us know, and then we'll make adjustments. So what you see here is functional outcome data. This is off Regenexx website. So, oh, I'm sorry. Give me a second. We're on. All right, let's minimize that. The screen is paused. All right. This is always the first time for everything. Let's pull that out. There we go. All right. So we're back. All right. So here what we see is this is some of the data I was referencing, where these are patients who've had back procedures, lumbar spine procedures, and on the vertical axis, the malfunction, which they do. And then on the bottom, on the horizontal axis, you're looking at, time of the procedure out to 6 years. So we're looking at the time of the procedure, the function of most patients is around 50%, and then you have sustained improvement throughout 6 years up to 72%. This is using a functional rating index scale where patients get questioned on, this is them saying what they can do. And about 72% of them at 6 years are still functioning well following procedures of the lumbar spine. And then this is another scale looking at, when you have a Regenexx procedure using PRP or BMAC, how's my pain doing? So we look at the pain scores of, every time you go to the doctor, what's your pain level, right? So we're looking at your pain level. And then we're following and tracking that out to 6 years, so you can see from the time of procedure 4.8, over 50% reduction, the same reduction in pain. So we just have a few more slides. And so, patients say, well, if I'm considering this, how does this work? How much am I going to pay? So prolotherapy is a technique that we use to help strengthen up and make joints more stable. That's on average $300 to $600, and then PRP could be anywhere from $1,000 to $1,500. Or we look at treatment of the spine, could be between $2,000 to $4,000, depending on what levels are we doing and how many are involved. And then we say stem cells or bone marrow concentrated treatments can range between $5,000 to $8,000. And that includes harvesting the cells, counting the cells, ensuring that they're going to live and you have their per number in order to ensure the best potential outcome, as well as re-injecting and then the follow-up appointment.
Do insurance pay any of that, or this is all out?
Well, see, you jump to the it's like you had these slides already. You must be Cleo the psychic. Okay. All right, actually, you're a psychic. All right, so see, that's a very good question. So does insurance cover this? Well, Regenexx has partnered with companies around the country, and there are over 6 million people that work for companies that their company offer this as a benefit. Okay, so not every company offers this or insurance plan covers this. Okay, so if you don't work for a company that offers this as a plan, then it likely is going to be something that comes out of pocket. Okay, now we'll work with patients related to that, regarding that, but still that's an out of pocket cost. Interestingly enough, if you have TRICARE insurance, and this is primary, TRICARE now covers it for the knees as well as the elbows, the lateral elbows. So if you have TRICARE, it's primary, not secondary insurance. It's got to be primary. It is something that is covered by TRICARE insurance.
What if you have TRICARE and Medicare?
Well, if TRICARE is primary,
Yes, primary, TRICARE.
if you fall into the thing where it's not covered, because TRICARE has to be primary.
Okay.
But we will talk about your condition, when we schedule your appointment and address all of those concerns.
I have a question. For Medicare payment,
Medicare does not currently cover it. They do not right now. And now, do not. Do not. So either you work for a company that offers this as a benefit, and those are what we call self-funded companies. Okay, and so that plan might be a Blue Cross plan, it might be a Aetna plan, and it might be a Humana plan, but because the company has decided to offer this to the employees because they want their employees to be present and working, they have to have a procedure. They want them to theoretically be back to work with a faster recovery, and it's less costly than them having an expensive. More and more, which is why we collected that on a commercial side. We would not have to worry about this. Okay, so right now it is not, and yes, they just have Medicare, but they don't want to have surgery. They've tried everything else and it hasn't worked, and they decided to have it done. And so it'll come down to a choice. And we can discuss that when we have our one-on-one appointments with you all, and we go from there. All right, so you can see some of the companies that offer this, and that's insurance coverage, right? That's special. And with those, we still have to function as if we have to do everything conservatively. So if you come to us and you haven't done anything, then guess what? We need to make sure that you have a musical interlude. We need to make sure that you have tried those things before we proceed with this type of procedure. And like I said before, you know, because of the number of patients who have had these procedures over time, all right, from 2005 to now, for 80,000 people, that means that we have the largest safety paper regarding this. Okay, it is safe. And like I said before, the most common pain that you want to experience is procedure site pain, which we numb up, and then post procedure, either you have medications to kind of help reduce those pains. Okay. We do have upcoming webinars on our website, rivercitysportsandspine.com. Up here, you can see that we have some upcoming webinars on October 9th, November 6th, and December 4th. And then in December, we'll put out a list for 2024. So if you are interested in learning about other things we treat, like I said, this is primarily focused on the spine and the knee, but we treat every joint that's in the body. And this is information on how to contact us. If you're interested, you think you want to get more information to see if you're a candidate or to determine, you know, how, even if you have to pay out of pocket, what we do will be beneficial for you, then we'll get in contact with our nurse, Jessica. There's a phone number listed there as well as an email address. And if you go to our website, there's also intake forms on our website. And so, were there any questions?
You say the VA won't pay for it?
Currently, the VA does not.
Well, that Medicare, you know, like, I put my there for, see about my back.
Well, not yet. The only time that Medicare would do something of that nature is if you had a work-related injury, and then you have money set aside to treat anything related to that issue. And so, but right now, Medicare doesn't cover this because it is still deemed as experimental, even though it's been performed since 2005. And, you know, over 80,000 people have had these procedures. We have functional outcome data as well as safety data. So the big insurance companies are a little bit slow to, there are lots of reasons, but it takes them a while before they will offer this to every person who carries their insurance. We do have a question. I'll read the question. So I've been talking for a while. See if Dr. Buzanowski wants to answer them. So how long between the initial visit where cells, platelets, and bone marrow are extracted to when the restorative procedure is injected and completed? And so I can answer that one. So it depends on what we're doing. So if we're doing just platelet-rich plasma or PRP, the procedure may be all in one day, or the cells can be, the blood can be obtained one day and then injected the next day, but we have to do everything within 24 hours. Or if you're having bone marrow concentrated cells, everything is done the exact same day. So the cells are likely harvested in the morning and then re-injected late morning or early afternoon. So everything to be in compliance with the Food and Drug Administration, everything is done within 24 hours. All right, so next question says, you may have covered this. Will the procedure work for bone-on-bone knee joints? And so the answer to that is we need to see what the extent of that is on X-rays and MRI. Have we done it? Absolutely. But and there are some patients that we didn't do it because there are other problems that exist within the joint that we felt knee replacement was the better option. And so we need to look at everybody individually and look at their imaging in order to make the proper determination. Because we're not going to offer you a procedure if we don't think it's going to work for you. Yes, sir.
The paper that got in my pocket, I'm like, what it called?
So that depends on what we're treating. What problems do you have? And I know. So we would do is we would look at If it's your back, we would also look at your hip, see if your hip or your knee are problem. And if all of those are problematic for you, or that the hip and the knee are also contributing to your pain and your functional issues, then when we offer to do the procedure, we're going to tackle all of those at the same time. And so in order to tell you how much it would cost, we would have to sit down, look at your MRIs, look at your x-rays, and make sure, one, that we can see it and we feel confident that your condition will respond. Two, we look at everything related to you besides your musculoskeletal problems. You know, what other medical conditions you have, what medications you're taking. Because there are certain things that we may recommend that have to be changed or discontinued in order to ensure that this would be very successful. There are some things and medications that you cannot take while we are considering doing this because it would interfere in the outcome of the procedure. And so that's why we need to have a one-on-one visit to go over all those things and get all those questions answered. And then I can give you an answer as to how much this is going to cost and what we would do. But at least seeing us, you would have a clear understanding of, one, what the problems is or are, two, how we're going to treat it, and then three, what we would expect as an outcome. And four, if we don't think it's going to work out for you, then we're not going to recommend doing a procedure. So somebody asked about insurance, and I believe I answered this, that insurance right now, if you work for a company that offers this part of your insurance options, meaning your treatment options as a benefit, then it's covered. And we still have to then go through it the same protocol as if it's an insurance-based problem where we're going through all the conservative treatments and all those things first before we get to this step. Commercial insurances without that don't pay for it. TRICARE, and again, does cover for knees and elbows. Knees and elbows, so it has to be primary TRICARE insurance. And then some work comp companies. So if you are a patient that's on this webinar and you have a work comp injury, some work comp companies will cover this because this is significantly less expensive than having surgery. But we only know if we present it to them, and we have done that before, and work comp companies have covered this. So yes, out-of-pocket costs are going to vary based upon what's elected to do, if it's PRP or bone marrow concentrated cells, and then what are we doing? And so to help the holistic approach, we want to treat everything we can in one session. We do. Because one, that's less expensive on the patient, and we get to treat more problems that may contribute to functional issues at one time. Any other questions?
Now, what is procedure called again? That's right.
So this is interventional orthopedics. Interventional. That means instead of cutting, we're doing things through image guidance with needles. Okay, so that's one. And what we're doing is using a Regenexx protocol, meaning that Regenexx started this back in 2005. And over the years, they've modified and improved things. Just like when you buy a car from 2005, over the years, what happens? It gets upgrades and it gets better fuel efficiency and it gets more features and gadgets. Well, the same thing happens to these procedures from 2005 to now. They've gotten improved. And so the whole treatment goal is to help fix whatever problem you're dealing with without you having surgery. So we've had some good examples of patients with a disc herniation that we injected it and it's resolved.
Yeah, I believe Medicare will pay for one in that deal, fine.
Okay, well, we'll talk. That's the individual thing we need to have together, and then we present it to them because just like every Blue Cross doesn't cover this, right? Every Humana doesn't cover this. Those are companies that offer this as add-on benefit for their employees. And if you have a certain Medicare plan where it's your money, then it may be different than the traditional Medicare option, but we'd have to look at that. And then make the right phone calls to determine if that is, something that they would cover.
Yeah, I'm calling, see.
That's why I would ask you what's the name of, so like if I call the insurance company and ask me that.
Well, you would tell them that you platelet rich plasma or PRP. Or bone marrow. We can write that down for you,
Yes.
then you can contact them and see. There's our musical interlude, which is our cue for the next slide. And so, if you say, man, I heard a lot today, this webinar will get replayed and recorded. And so you might get prompted that to follow up on that, but you can visit us and follow us on Instagram, on Facebook, as well as YouTube, and just look up River City Sports and Spine. And our website will pop up, and you can look at our YouTube channels where we put up testimonials and other good informational video about cells, injections with PRP, et cetera. Yeah. All right, so I want to thank everybody for coming, even though we had a miscommunication on in person versus virtual, et cetera. So we appreciate you coming in person, and those of you who are virtual, thanks for taking time out of your day to spend a little bit of time with us to learn about this procedure.